That every day we have more of a pervasive internet economy. And the internet economy is dedicated to providing the consumer what they want, when they want, at a cost price that is acceptable to them. And that's creeping obviously into every dimension of people's lives and their economy, especially for a particular age group, you know, anybody from 15 to 45 at this point. And as a result, there isn't any reason to expect that wouldn't begin to happen in healthcare as well. It's a little different in terms of how the application goes, because the way the healthcare delivery system has worked for years and years is that doctors and hospitals predetermined how people got care, and then the only alternative from a consumer perspective was to accept that delivery system. There was no alternative. There was no way to work around it. And so what's happening right now is that we're seeing every sign that the internet economy is beginning to creep into the healthcare delivery system in really hundreds of different ways. A different way every week. There's a different situation, and that the consumers are starting to have alternatives and be able to vote with their feet and with their pocketbook as to their decision making about how and where and in what way they want to receive care. And so, you know, for example, CVS just recently announced that they have seen 25 million different patient visits in their retail clinics. They are now the largest retail clinic in the country. Walgreens has made it very clear that outside of the Veterans Administration, they give more flu shots than any other. So these are just little symptoms and samples, but these are things that if you went back 5 or 6 or 7 or 10 years ago, these would have been aspects that were dominated by the legacy delivery system, and they're not anymore. And then of course we have, you know, all of the various apps that allow people to get their care and think about it in a different way. You don't have to necessarily call your doctor to get information anymore. You can go up on WebMD. If you have any kind of a sort of quasi-emergency and you choose not to go to the emergency room because you don't think it's that complicated, then you can go on MD Live, or you can go to Teladoc, and people more and more are actually using these things and allowing themselves a different way of visualizing the delivery system going forward. The question becomes, how will the legacy delivery system react to this? Will it look to compete and participate, or will it just say, you know, that's a different side of the delivery system, that's not the delivery system we do. We insist on a certain level of command and control. We insist on a certain level of discipline in terms of the way that we deliver care. And if people choose to go outside our way of doing business, then that's up to them, but we're not going to change. I think there are a lot of observers out there who believe that for the legacy system, you know, to make that decision, that what will happen is they will be giving away more and more business all the time. And they will be giving away that business at a place where the marginal revenue contribution to the overall profitability of individual organizations is pretty high. And therefore, as a result, low-intensity work continues to go away, and they're left with high-intensity work that brings with it very high costs as well.